Imagine your immune system as a highly trained security team, always on guard to protect you from outside threats. Normally, this team distinguishes between your own cells and harmful invaders like viruses. But in autoimmune diseases like lupus, this system malfunctions. Suddenly, your immune system mistakes your own healthy cells for enemies and attacks them. This internal assault leads to inflammation and damage throughout the body. Lupus is a prime example of this betrayal. Your body's defender becomes the attacker. The immune system creates autoantibodies, which target your own tissues instead of foreign invaders. These attacks can affect many organs, causing a wide range of symptoms. Understanding that lupus is your body fighting itself is the first step to grasping this complex disease. It's not just a malfunction, it's a war within. Recognizing this helps explain why lupus can be so unpredictable and challenging. This is the central story of lupus, your greatest protector turning into your greatest threat. Lupus is a chronic autoimmune disease, meaning it lasts a long time and is caused by your immune system attacking your own tissues. The most common type is systemic lupus erythematosus, or SLE, which can affect many organs and systems in the body. Unlike a cold, lupus doesn't go away after a week. It requires ongoing management. The term systemic means lupus can impact the skin, joints, kidneys, heart, lungs, blood vessels, and even the brain. Symptoms and severity vary widely from person to person. The name lupus comes from the Latin word for wolf, inspired by the facial rash some patients develop. Erythematosus refers to the redness of these rashes. But lupus is much more than a skin problem. It's a disease that can affect nearly every part of the body. Lupus is not contagious. You can't catch it from someone else. With modern medicine, people with lupus can manage their symptoms and lead full lives. Understanding lupus as a long-term systemic autoimmune disease is key to managing it. This foundation helps you navigate the challenges ahead. Lupus affects people of all backgrounds, but it's far more common in women, especially during their childbearing years. About 90% of lupus patients are women, suggesting hormones like estrogen may play a role. The disease is also more common and severe in women of color, including African American, Hispanic, Asian, and Native American women. Genetics matter. Having a family history of lupus or other autoimmune diseases increases your risk, but genes alone aren't enough to cause lupus. Environmental triggers, like sunlight, certain infections, stress, or medications, can set the disease in motion for those who are genetically susceptible. Lupus is not caused by a single factor. It's the result of a complex interplay between genes and environment. The risk is higher in some populations, and the disease can appear earlier and be more severe. Understanding these risk factors helps explain why lupus looks different in different people. Recognizing your own risk can help you and your doctor catch symptoms early. Early awareness is crucial for better outcomes. Lupus is a puzzle with many pieces. Genes, hormones, and environment all play a part. Lupus is called the great imitator because its symptoms mimic many other illnesses. Common signs include extreme fatigue, joint pain, and the butterfly-shaped rash across the cheeks and nose. Other symptoms can include fevers, mouth sores, photosensitivity, hair loss, and Raynaud's phenomenon, where fingers and toes turn white or blue in the cold. Symptoms can vary widely and change over time, even in the same person. Lupus is marked by flares, periods when symptoms worsen, and remissions when they improve or disappear. Flares can be triggered by stress, sun exposure, or lack of sleep. The goal of treatment is to prevent flares and keep lupus in remission as much as possible. Because symptoms are vague and come and go, lupus is often misdiagnosed or overlooked. Tracking your symptoms and sharing them with your doctor is essential for an accurate diagnosis. Recognizing patterns can help you manage the disease more effectively. Lupus is unpredictable, but understanding its signs gives you a head start. Lupus doesn't just cause rashes and joint pain, it can silently damage major organs. The kidneys are especially vulnerable. Lupus nephritis can lead to kidney failure if untreated. Heart and lung involvement can cause chest pain, increase heart attack risk, and lead to inflammation of organ linings. Lupus can also affect blood cells, causing anemia or increasing infection and bleeding risks. The brain isn't immune. Lupus can cause headaches, memory problems, and even seizures. Many organ complications develop quietly, so regular monitoring is vital. Early detection and treatment can prevent irreversible damage. Managing lupus means protecting your organs before problems become severe. Diagnosing lupus is like solving a mystery. There's no single test that gives a clear answer. Doctors gather clues from your symptoms, medical history, and a thorough physical exam. Key signs include the butterfly rash, joint swelling, and unexplained fevers. Blood tests look for autoantibodies like ANA, but a positive result alone isn't enough for diagnosis. More specific tests and urine analysis help confirm lupus and check for organ involvement. Diagnosis often requires a specialist called a rheumatologist. Keeping a symptom journal can help your doctor see the bigger picture. Diagnosis is a process of elimination and pattern recognition. The right diagnosis leads to the right treatment. There's no cure for lupus, but treatment can control symptoms and protect your organs. Mild cases may be managed with NSAIDs for pain and anti-malarial drugs, like hydroxychloroquine to reduce flares. Severe lupus may require corticosteroids or immunosuppressants to calm the immune system. Doctors aim to use the lowest effective dose to minimize side effects. Lifestyle changes are crucial. Protect yourself from the sun, get enough rest, eat well, and exercise gently. Managing stress through meditation or yoga can help prevent flares. Treatment is tailored to each person's symptoms and organ involvement. With the right plan, most people with lupus can live active lives. A lupus diagnosis can feel overwhelming, but it's not the end of the road. Advances in treatment mean most people with lupus can live long, fulfilling lives. Regular checkups with your healthcare team are essential for monitoring symptoms and adjusting treatment. Open communication with your doctor ensures your care stays on track. Building a support system, family, friends, and support groups makes a big difference. Taking an active role in your care, from medication to lifestyle changes, empowers you. Recognize early signs of flares and know when to rest. Managing lupus is about partnership, self-awareness, and resilience. You can take control and pursue your goals. Knowledge is your best tool against lupus. Understanding the disease replaces fear with confidence and control. Knowing your triggers and how to avoid them helps you manage symptoms. Sun protection, stress management, and healthy habits put you in charge of your wellness. Education transforms you from a passive patient to an active participant in your health. The more you know, the less you fear. With the right information and support, you can live fully with lupus. Remember, knowledge is power. Use it to live your best life.